Hey guys, today I want to talk about an entity that gets a lot of attention on social media known as topical steroid withdrawal. This is a particular concern for people who have a type of eczema known as atopic dermatitis. Topical steroids are a mainstay in the management of many inflammatory skin conditions in dermatology. Not only are they very effective, but they're super safe when used appropriately. However, like any medication, there are possible side effects. I have a video, as a matter of fact, going over some of the most common side effects we encounter topical steroids, so check that one out if that's of interest to you. But we're going to be focusing on the warning signs of a lesser encountered, poorly understood entity known as topical steroid withdrawal or red skin syndrome. If you ask any dermatologist what their thoughts are about topical steroid withdrawal, they'll likely tell you something to the effect of, it does happen, but honestly, I've never seen it, it's rare. This isn't because they're lying to you or gaslighting you. It is uncommonly encountered in a dermatology practice because when prescribed appropriately and monitored, topical steroids, they are safe and this shouldn't happen. But it does happen. Unfortunately, it's poorly understood. There's not an established diagnostic criteria for topical steroid withdrawal. There's no test for it. That's not because dermatologists don't care about it or are not trying. In fact, there are active ongoing studies with regards to topical steroid withdrawal. What we know about it is that it seems to be more common in women compared to men. It tends to affect the face and the genital area, although it's not limited to these areas. It likely affects these areas because the skin there tends to be more delicate and vulnerable to the effects of topical steroids. Topical steroid withdrawal is characterized typically by the onset of confluent areas of bright red skin. Usually this appears within days to weeks of stopping a topical corticosteroid, and there are accompanying symptoms of burning and stinging skin. Online, you mostly hear people talking about topical steroid withdrawal, but steroid medications are also given by mouth. They're given intramuscularly. Steroid withdrawal is possible with oral courses of corticosteroids as well as getting steroid shots. I'm going to go over some of the most common warning signs of topical steroid withdrawal that one might encounter, but keep in mind, there's actually a lot of heterogeneity out there in terms of the different presentations of this entity, and like I said, it's poorly understood in an area of active and ongoing research. Something that raises a huge, bold red flag for the possibility of topical steroid withdrawal is the patient's history. Patients with atopic dermatitis, their skin flares up, calms down, and patients being treated for their atopic dermatitis, they still can develop flare-ups, but the goal is that over time the flare-ups become less frequent and less intense. With topical steroid withdrawal, the history is very unique in that not only do the patients continue to have flare-ups, but the flare-ups are getting worse and worse, and they are being escalated on their topical steroid regimen. They're being prescribed stronger topical steroids, but they are still having more intense flare-ups. They're being prescribed topical steroids to be used more frequently. They're relying on them for extended, prolonged periods of time. This is a big red flag for the possibility of topical steroid withdrawal, because if you watch my video on the side effects of topical steroids, I highlight the fact that topical steroids are not something that are used long-term and definitely without taking a break. Taking a break from topical steroids is necessary, but if your eczema is so severe that you seemingly are dependent on topical steroids and you still need even more and stronger potencies, well, that's definitely a warning sign. Let's get into the skin warning signs. And remember, there's a lot of heterogeneity out there in terms of how this might manifest, but one of the most common skin warning signs of topical steroid withdrawal is red skin. In fact, it's commonly referred to as red skin syndrome. The red skin can be widespread, meaning covering large surface areas. It's typically confluent, meaning the entire area is bright red, not just patches and blotches of redness. The redness occurs within days to weeks of stopping the topical steroid, and if the patient continues long-term to use the topical steroids, that redness can actually spread to other areas where you were never ever applying a topical steroid to begin with. Warning sign number 2 is the red sleeve. This is a descriptive term for confluent redness, usually on the arm or the leg, that literally looks like you are wearing a red sleeve, and it abruptly stops at your wrist or at your ankles. Warning sign number 3 is called the headlight sign. This is where you have facial redness that spares the nose and around the mouth. The redness typically ends at the mid-cheek with normal appearing skin from the outer cheek out to the ear. Warning sign number 4, elephant wrinkles. This is a descriptive term for areas of thickened skin with loss of elasticity that look like elephant wrinkles, typically on the front of the knee and around your elbow, but not limited to these areas. These prominent areas of thickened, wrinkled skin, they're not permanent, but they take several months to go away. Outside of these main skin findings, you can also have swelling of the skin and skin edema. You can have the eruption of what sort of looks like acne with little pus bumps, the development of prominent dilated blood vessels known as telangiectasias. You can get a lot of flaking, scaling, oozing, and weeping as well. The symptoms are debilitating. The skin burns, it can be painful, it can itch, and a lot of patients experience significant mood disturbances when they are coping with topical steroid withdrawal, often feeling very down, very depressed. This negatively impacts overall quality of life. Topical steroid withdrawal also can have a profound impact on overall sleep quality, which if you have atopic dermatitis, you know how intimate good sleep and atopic dermatitis control are. And once sleep suffers, itch intensifies, and it's a slippery slope. Some patients even become photosensitive, sensitive to the sun. Why do people develop this in the first place? The mechanism of the disease is not well understood, but again, it is an area of active and ongoing research. It's thought to possibly be related to the impacts of topical steroids on the local immune system in the skin where they're being applied, as well as the blood vessels. Topical steroids decrease something known as nitric oxide. Nitric oxide is important for blood vessel vasodilation, as well as for mast cell function. When you remove the topical steroids, then you get a rebound increase in nitric oxide and a sudden vasodilation and redness. This vasodilation can impact the patient's thermoregulatory systems, and oftentimes these patients report that they have this feeling that they are cold all of the time. So those are some of the skin findings and the symptoms that go along with topical steroid withdrawal. However, there are a lot of mimickers, so getting the correct diagnosis is key. I think a lot of people who struggle with their atopic dermatitis and likely poor access to dermatologic care and seeing the same dermatologist regularly, I think this is where you can really find yourself in a slippery slope. Whatever you do, you don't want to self-diagnose with topical steroid withdrawal, because there are a lot of things that can happen to the skin that look like topical steroid withdrawal but are something totally different. And these things commonly happen to patients who have atopic dermatitis, type of eczema. What are some of these things? Number one is that topical steroid withdrawal can look very much like a fungal skin infection, ringworm, because patients with ringworm who apply topical steroids, the ringworm will improve while they're using the topical steroids, but in reality, the appearance of the rash improves and the symptoms improve while you are using the topical steroids. However, the use of topical steroids allows for the fungus causing the rash to proliferate, to thrive, and to become more extensive, more involved. So what starts out as a little patch of ringworm that you may be mistaken for your eczema can turn into a full-blown serious fungal infection. The second is allergic contact dermatitis to your topical steroid medicine. Maybe you have developed an allergy to the medication itself or to one of the inactive ingredients in the medication. This can happen, and it looks an awful lot like topical steroid withdrawal, but in reality, it's just that you have become allergic to the medication. Number 3 is allergic contact dermatitis, but not to your medication, but rather to something you are coming in contact with. And in this case, it's going to fit that red flag of requiring more steroid to control your condition, and that it gets much worse when you stop. Because so long as you are coming in contact with the thing that you are allergic to, your body is going to be aggressively trying to make an eczema rash to reject that allergen. So that's another one. The fourth possibility is that you have a side effect to the topical steroid that is not topical steroid withdrawal. Some of the other side effects can look similar. For example, if you have been using topical steroids on your face, it's possible to develop what's known as steroid rosacea. The dilated blood vessels, the facial redness, the little pus bumps, that is steroid rosacea, not topical steroid withdrawal. And it's important to distinguish because you could still be using topical steroids to other body sites, sparing the adverse effect on your face. So diagnosis is key. Because we don't have good diagnostic criteria for topical steroid withdrawal, a dermatologist has to exclude it by making sure you don't have some of these other things that I have just mentioned or other skin conditions, depending on how your symptoms present. Because again, there is some heterogeneity in terms of how people are presenting with this as far as what their rashes look like. So it's a diagnosis of exclusion. When we biopsy the skin of topical steroid withdrawal, all that we see under the microscope is eczema. So a lot of inflammatory infiltrate characteristic of the eczema. How does one go about treating topical steroid withdrawal? Well, the first step is to stop the topical steroids. Stop the topical steroids. But the patient also has to be aware of the fact that steroids are in other medications that they may be taking, which also would need to be stopped, including the pill form, steroids that are given through a shot, steroids that you inhale, steroids that go in your nose, steroids and eye drops also may be contributory and would need to be stopped. If you dive into the research, here are some treatment modalities that have been shown to be helpful for patients who are experiencing topical steroid withdrawal and need to treat their skin. These include tetracycline antibiotics, like doxycycline, for example. These antibiotics, while you think of them to treat a bacterial infection, they have anti-inflammatory effects that can be beneficial. Antihistamines to help with the itch. Then a class of medications that are a game changer in the management of eczema known as calcineurin inhibitors. These include tacrolimus, pimcrolimus, which go by the brand names Elidel and Protopic. Some patients need a course of a medication known as cyclosporin, which can help calm down the immune system. Phototherapy is underrated in general for atopic dermatitis, but can be very, very helpful here. Doesn't require necessarily a medication, although a medication may also still be needed, but some patients are actually able to control their atopic dermatitis through phototherapy alone, provided they can go to the frequent visits and they have a dermatologist in their area who offers phototherapy. Lastly, the medication dupilumab, brand name Dupixent, has successfully treated patients who have topical steroid withdrawal. Now, fortunately, in the past several years, we have gotten newer medications to treat atopic dermatitis. Used to be back in the 1950s, all we had was topical steroids. Now we have a ton of medications. JAK inhibitors, calcineurin inhibitors, of course, phototherapy has been around for a while, but we have a lot more options these days, is what I'm saying, besides topical steroids. But topical steroids still remain a mainstay in management of atopic dermatitis. You'll find in any guideline for atopic dermatitis because they are effective for clearing up the skin. Topical steroid withdrawal can be prevented in a few ways. First of all, making sure that you follow up regularly with your dermatologist. Try and stick to the same dermatologist. Easier said than done when insurance changes coverage and things get wonky, but that would really be ideal. The second is to understand the treatment protocol and to follow it to a T. Make sure that your dermatologist explains how to properly use the medication and exactly for how long and what to do once you stop using the medication. The other way to reduce the chances of side effects and to reduce your overall reliance and need for topical steroids, reduce the number of eczema flare-ups that you experience, is to use a moisturizer. A bland, fragrance-free moisturizer is a mainstay in reducing flare-ups, and when you use a moisturizer consistently, not only does it help reduce flare-ups, but it does help your skin need the steroids less, so you don't have to use them as frequently. Alright guys, that's what I wanted to say with regards to topical steroid withdrawal. I really hope this video was helpful to you guys. I know it's a very frustrating thing to deal with, and a lot of patients feel frustrated. They feel like their concerns have been dismissed, post on the end slide, I'm going to put my video all about eyelid eczema. So check that one out if you missed it, because I give a lot of tips and tricks there. But if you enjoyed this one and it was helpful, give it a thumbs up, share it with your friends. And as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.